Welcome to Health and Wellness. I'm your host, Kearni Warren, and on today's episode, I'm speaking with Dr. Kathleen Rupertus, who is a therapist that specializes in anxiety disorders. Today, we're focusing on obsessive-compulsive disorder and the various treatments. Dr. Rupertus, thank you so much for taking time out of your schedule to speak with us about anxiety disorders and obsessive-compulsive disorder. Can you tell our viewers a little bit about your professional focus?
Yes, I work with a variety of different anxiety disorders, working with individuals as young as 4 years old and up to individuals in their 80s, and with a wide range of different anxiety disorders, including social anxiety, post-traumatic stress disorder, generalized anxiety disorder, panic disorder, obsessive-compulsive disorder, wide range of diagnoses.
Okay, now speaking about anxiety disorders and obsessive-compulsive disorder, are anxiety and obsessive-compulsive disorder interrelated?
Very much so, yes. Now, anxiety is a regular part of everyday life, so people can have anxiety but not have an anxiety disorder. Anxiety is actually a very positive thing in our lives, and it's a very motivating experience, and so if you are nervous about a job interview, then your anxiety can be a motivating force in preparing for that interview. If you're faced with danger, it's a good thing to feel that surge of anxiety to be able to prepare you to either fight or flight from that particular situation. So OCD is a form of an anxiety disorder. An anxiety disorder is when that fight or flight response goes off when there truly is not an objective threat to that individual. So individuals with OCD experience a lot of anxiety as a result of the thoughts that they experience. And then also general anxiety that one might experience in life can also impact the OCD and make that worse.
Okay. Can you speak about some of the common misconceptions about OCD?
Absolutely. For a lot of people, when they first hear about the different thoughts or obsessions that an individual has, they'll try to apply logic, and they'll just say, well, but you know that that can't happen, or if you just read up on that, you'll see that that's not how that can happen. And logic plays really no role in being able to overcome an anxiety disorder. In fact, trying to use logic actually reinforces the anxiety that the person is experiencing.
Okay, so I want to go back to obsessive-compulsive disorder and anxiety disorder. You just said that you spoke about overcoming anxiety disorders. Can you speak about the umbrella? Where does anxiety disorder and obsessive-compulsive disorder fall in together?
Okay. Well, it used to be in our former Diagnostic and Statistical Manual, which is used by psychologists and therapists and psychiatrists to diagnose. It used to be that anxiety disorders, I'm sorry, let me reverse that OCD used to be part of, or listed as an anxiety disorder. And with the most recent publication of the newest Diagnostic and Statistical Manual, it's now been separated out from the anxiety disorders, and it's listed under obsessive-compulsive spectrum disorders. But what's still generally understood and accepted is that anxiety is still a very large component in obsessive-compulsive disorder.
Okay, so can you speak to us about some of the different types of obsessive-compulsive disorders?
Yes, you mean the symptoms of OCD?
Well, the different spectrums of OCD.
Okay, all right. So there's obsessive-compulsive disorder, and then there's also hoarding disorder, which in our old Diagnostic and Statistical Manual was considered just a part of OCD. So if somebody had a hoarding disorder, they were diagnosed with OCD. But what the research has shown and how individuals respond to the treatment very differently, it's been realized that they're really two separate but related disorders. So there's obsessive-compulsive disorder, there's hoarding disorder, there's also another disorder called trichotillomania, which is compulsive hair pulling. and that's considered an obsessive compulsive spectrum disorder, as well as skin picking, people who compulsively pick at their skin. So there are many people who will have one of those spectrum disorders as well as another one within there, and there's just a lot of overlap in terms of the obsessive and compulsive components of all of those disorders. What makes them all considered an obsessive compulsive spectrum disorder is that there's an obsessive and a compulsive quality to it.
When should someone seek help for OCD?
At the point in which it starts to interfere with their daily functioning in life. There are some people who will joke about, oh, I'm so OCD, and they just like to be organized, or they like to be very neat. And they take that very lightly. It doesn't have a big impact on their life. But for somebody where those kinds of thoughts or tendencies begin to really interfere with their life, where something that started out where they're trying to be more organized, and now they're spending hours trying to be organized, and what used to be organized enough now is nowhere near perfect enough. So that the more it starts to impact life, the more time that's consumed by that, the more that it interferes with just your daily responsibilities and just really your enjoyment of life. And specifically with children, the earlier that they can get in for treatment, the better. Otherwise, they go through years and years of struggling with OCD and just reinforcing their fears through all of their rituals. And so the sooner that a person can get into treatment, the better.
What are some of the symptoms of OCD?
Okay. Well, OCD consists of obsessions, which are unwanted and intrusive upsetting thoughts, images, or impulses. So the obsessions are what really makes the person anxious. So they have an obsession and their anxiety starts to go up, and then they engage in what's called a compulsion or a ritual, and that's what they do in response to that obsession to try to bring their anxiety down. So there are many, many different types of obsessions, and really anything can become an obsession. But some of the ones that are more commonly focused on in the media are things like contamination. So worrying about, if I touch this, am I going to get sick? Or even, could I get so sick that I die? If I touch this, sometimes it's just not that I'm going to get sick and die, it's just really gross and disgusting, and I don't want to feel that feeling. Other types of obsessions can be concerns that when they're talking with somebody, that they are saying something rude or ignorant, or that the person is getting angry at them. So if they're having this obsession, or, oh, did I say something offensive? A ritual or a compulsion might be then they start rehearsing in their mind that conversation and trying to picture the person's face and, well, were they upset with me? Or going back to that person afterwards and saying, I'm sorry, did I say something upsetting to you? So that obsession, which raises their anxiety, they address that by engaging in these compulsions to bring that anxiety and that uncertainty down. Other types of common obsessions have to do with being responsible for something horrible happening, like a fire or somebody breaking into the house. So individuals with those kinds of concerns and obsessions might engage in rituals such as going back and checking the stove repeatedly, or making sure that electrical appliances, things that have been used, have been unplugged. Even driving home after a half an hour trip out, driving all the way back home again because they just can't bear that uncertainty of, what if I left something on and then my house were to burn down? It would be all my fault. It could be things like going back and checking door locks for fear that somebody could break into the house and they could hurt their family, and again, it would be my fault. So this sense of responsibility for bad things happening, which they then address through doing these compulsions to bring their anxiety down. In younger children, a lot of times we'll see a different expression of symptoms, certainly the same as adults, but they have kind of their own as well, that can have to do with their handwriting, and handwriting being perfect. And they'll go back and they'll keep writing and rewriting and erasing, and this can affect them in school, where they're not getting their schoolwork done on time, they're not able to complete their tests on time. There's another form of OCD that's present in adults as well as children called magical thinking. So for a child who may have some magical thinking obsessions around handwriting, if they're writing and they have suddenly a thought that mom or dad could get hurt, they have this ritual where they'll go back and they would erase that word, and they're going to write that word all over again, but this time have a good thought, with the idea that if I leave that word there that I wrote when I was having a bad thought, that bad thing can now actually happen. But I can magically undo it if I erase the word and think a good thought as I'm writing that word out. They can also have some rituals where it just they were writing and something just didn't feel right. They had not so much of a thought, it just didn't feel right as they were writing it, and that might mean that something bad could happen. So again, it would be going back and rewriting words and things that they've written. They also can have some reading rituals where as they're reading, again, if they have a thought of something bad happening, having this thought, well, oh, I have to go back to the beginning of that page or back to the beginning of that chapter and read it all over again without having a bad thought. And what happens is when somebody tries harder and harder to not have a particular thought, it's very paradoxical in that the more you try to not have a particular thought or feeling, the more likely you are to have that thought or feeling. And so these rituals that are really designed to bring an individual's anxiety down and get rid of that thought actually increase the likelihood that they're going to keep having those thoughts over time. So the very things that were designed to get rid of the thoughts end up perpetuating the disorder and the impact that that has on an individual's life.
Wow, it sounds like the intrusive thoughts and the compulsive behaviors could really stunt a person's growth and limit the amount of freedom of living. What are some of the therapeutic strategies that you use when seeing clients?
Well, what research has shown us is that the most effective form of treatment is a form of cognitive behavioral therapy that's specifically called exposure response prevention. Ultimately, the goal of exposure response prevention, or ERP, is to help the individual to learn to live with the uncertainty of their thoughts. So we live with a great amount of uncertainty every day. And for most of us, our heart and minds can deal with that uncertainty. And we're perfectly comfortable going through our day, assuming that the risks that we face today are going to turn out just fine, and today will be very much like yesterday, and tomorrow will be very much like today, and so forth. For an individual with OCD, their ability to tolerate uncertainty when it comes to their specific obsessions is really compromised. And so the rituals that they perform are to help them to gain like 100% certainty that whatever they're afraid of isn't going to happen. So, for example, one of the uncertainties that we live with every day is each time we get into our car. And if we really stopped and thought about it, there's a risk involved in getting into our car. And we could die trying to get to where it is that we are going. And if we stopped and thought about that every single time that we got into our car, we would probably kind of shudder a little bit and then proceed and just get into our car and go, because we're willing to take that risk. The alternative is that we begin to weed risk out of our lives, like, well, I'm not going to get into my car because something bad could happen. Oh, well, I'm not going to leave my house because something bad could happen. And your world gets smaller and smaller and smaller. So we live with these risks every day, with the idea that if and when that happens is when I will deal with it. In other words, I will deal with life the way that it unfolds. So if something bad happens, that's when I'm going to deal with it. For somebody with OCD, the uncertainty of whether that thing is going to happen and whether they're going to be able to handle it is overwhelming to them. So they engage in these rituals. So for example, if someone is concerned that if I touch the floor and I don't wash my hand, that there could be some horrible form of contamination on the ground and it could make me sick. So they just can't shake that feeling of uncertainty of what if, and they feel the need to go in to wash their hands. All right? So what we're trying to teach an individual with OCD is to go about that fear in the same way they would their everyday uncertainties, to learn to live with that uncertainty. So certainly they could get sick from not washing their hands, but what an individual often misses is that through all of their rituals and all of their obsessing over not getting sick, they're trying to prevent this one bad thing from happening. But what's actually happening in their life is even worse, that they're spending a lot of time washing their hands, a lot of time worrying. It's difficult for them to stay present when they're with their friends or at their job. They may be losing sleep. They may be pushing off other responsibilities because they're consumed with their thoughts and with their rituals. So it's helping people to live with that uncertainty. So in therapy, exposure would be, okay, well, you know what, we're going to touch the floor. And you're going to start to feel uncomfortable. And now, for most people, their ultimate fear is that that contamination is going to get in their mouth. So we're going to either lick our hands, we're going to grab a piece of candy, we're going to roll it around in our hands, and we're going to pop that piece of candy in our mouth. And we are actually going to do the very thing that their anxiety told them do not do. All right? So now the individual is starting to feel very, very anxious. All right? So when an individual, though, allows themselves to feel anxious, and objectively there's no threat, if they allow themselves to feel anxious long enough and just accept, yes, I might get sick, yes, I might get sick, their anxiety may start to go up first, but eventually it's going to go down on its own. It's back to that swimming pool metaphor. You stay in the pool long enough and feel uncomfortable, and eventually you no longer feel uncomfortable. So our heart and our mind is able to do that with the uncertainty of the obsession and the uncertainty of what's going to happen as a result of me touching that floor. We never tell a client that their worst fear is not going to happen. It's truly about learning to live with the uncertainty, but help them to look at it a little bit differently. So maybe you're going to get sick, but let's take a look at your life and what is happening right now. Not that might, but that is happening. Are you being the wife or husband that you want to be, the parent that you want to be? Are you fulfilling your own potential? So you may be preventing yourself from getting sick, maybe, but here are some other things that are happening right now to your life. And the OCD is really, really good at pulling people's focus off the big picture of their life and onto something that's really small and insignificant. So when an individual is able to touch that floor and get the contamination in their mouth over and over and over again, eventually the heart and the mind is able to work through that and say, it's not a big deal. And that anxiety comes down over time.
Is OCD something that people have to learn to manage throughout their life, or is it something that can be cured?
OCD is considered a chronic disorder. So most people who have it are going to have it to some degree over the course of their lifetime. It has a waxing and waning cycle to it. And so most individuals with OCD will tend to go through periods of time where their OCD is worse and times where it seems to be kind of more setting into the background of life. But through the course of treatment, they also learn what's called relapse prevention, and it's a matter of being very aware of what the triggers to their OCD can be and being able to check in with themselves periodically to be able to recognize as soon as possible if they are starting to respond to obsessions through rituals and so forth. And when we look at treatment, the goal isn't so much that an individual stop having obsessions, although fortunately, through treatment, that's often the case. There's a significant reduction in the thoughts. But what we repeatedly say is the thoughts themselves are not the problem. You can have all kinds of upsetting thoughts and be able to just keep going about your life. The problem is when people start engaging with those thoughts and saying, I don't accept this thought or this feeling, and pushing it away. And the paradox with anxiety is the more that you try to push away thoughts and feelings, the more likely that those thoughts and feelings are going to push back. And by doing the rituals and trying to make them go away, they're actually reinforcing those thoughts and increasing the likelihood that they're going to continue to occur. So being free from OCD does not mean never having another obsession. It's learning to be able to tolerate the anxiety and the uncertainty of that obsession and just allow the thought to be there until it sort of plays itself out, instead of trying to push it out any sooner than it would naturally work its way through.
You mentioned your heart and mind can learn to deal with uncertainty. Mm-hmm. You also mentioned having your clients to be able to reach their full potential. Mm-hmm. Is that a personal primary goal for you as a therapist, to see your clients reach their full potential? Mm-hmm.
Absolutely, and a lot of people will come in thinking that because of this they have to put their hopes and their dreams on hold. And I work really hard at helping to sort of lay this foundation for them that while their primary goal may be to finish treatment with having less OCD symptoms, I think that they're going to end up coming out of it with something much greater, and it's this greater confidence in themselves. I'm very honest with people up front that treatment is difficult. It's really, really difficult, but there are many very difficult things in life that are extremely, extremely worth it, and this is one of those things. And that what they're going to learn about themselves, what they're capable of doing, what they learn about themselves in the therapeutic process is actually going to prepare them even more, and maybe have them shoot a little bit higher in terms of their hopes and their dreams and what they're working towards for their future. So there's a lot to learn, not just in dealing with OCD, but learning about yourself through the therapeutic process.
Tell me about your involvement with the International OCD Foundation.
Okay, so the OC Foundation is an international foundation that's kind of a clearinghouse for information about OCD. I would encourage anyone who is affected by OCD to go to their website, which is www.ocfoundation.org. What's really unique about this organization is that they have an annual conference. This year is in Boston, and it's a conference that's designed for individuals with OCD as well as their loved ones. And it's kind of a coming together of the leading experts in the area of OCD, and there are workshops there for parents, for adults with OCD, children, teens, college-age students. And I think the greatest message to convey that the foundation does a fantastic job with, and I hope to convey to my clients, is that there is hope, even in the midst of the struggles with OCD. And one example of that is that I've been going to these conferences for about 16 years now, and there are certain kids who started going maybe at 12 or 13 years old, and I recall working with them with their OCD, and they are now doing their own workshops. They're college age now, and they're doing workshops for high school kids and encouraging them to shoot for their dreams, to go to college, advising them, do I write a college essay about my OCD, or should I keep that quiet? So there's a tremendous amount of hope, and you get to see that through the conference, and I get to see that through my work with my individual clients.
Thank you for watching Health and Wellness. Again, I'm your host, Kearni Warren. Dr. Rupertus is located at the Silverside Car Executive Center in Wilmington, Delaware. For more information, please go to her website.
And that is www.ocddelaware.com.
Thank you for watching.